We're going to be doing lateral side bending goniometry of our cervical spine. So for our patient, the fulcrum is going to be C7. So I'm going to have the patient flex their neck forward just to locate C7 and palpate. So C7 is right here. Our fulcrum is going to go at C7. Our stationary arm is going to be parallel to the spinous process of the thorax. And our moving arm is going to be pointing to the occipital protuberance. So I'm going to have you bring your right ear to the right shoulder, please. Very good. That's good. All right. So patient's active range of motion of lateral side bending is 37 degrees. We're going to be doing shoulder complex flexion goniometry. Our fulcrum is going to be at the greater tubercle, where we're going to have our stationary arm parallel to the thorax and axillary, and our moving arm is going to be along the midline of the humerus. So actively bring his shoulder into flexion. Okay. Okay. He's measuring 180. Okay, bring it back. I'm going to assess his end feel now, stabilizing at the trunk and ribs. Sorry. Good, end feel is firm with a little bit of overpressure. And now I'm assuming that his passive range of motion is also going to be about 180. I'll leave my goniometry there. Bring back his arm and assess the range of motion. Okay. Beautiful. It's about the same, 180. Okay, so we're going to be measuring the glenohumeral joint internal rotation goniometry. So we're going to first stabilize the scapula by palpating the coracoid process and the acromion. We're going to have to actively internally rotate his hand. Good. That's where I start to feel his scapula starts to move. Okay, so I'm going to get the measurement. Fulcrum is going to be at the olecranon process. The stationary arm is going to be parallel to the thorax, and our moving arm is going to be parallel to the ulna. So his measurement is 42 degrees. His end feel. So again here. Okay. Good. Applying a little bit of overpressure. Good. It has a firm end feel. Now we're going to be measuring his passive internal rotation. Okay, so right there is when I start to feel that. Good, hold it there. Same position. Good. So his passive range of motion is about 60. Okay, so we're gonna do the glenohumeral joint abduction range of motion. Patient actively bring his arm to abduction while I first stabilize the lateral border of the scapula. Okay, abduct the arm right there. That's when I start to feel it. Hold it right there. Okay, so our fulcrum is going to be on the anterior aspect of the acromion, while our stationary arm is going to be parallel to the sternum, and our moving arm is going to be parallel to the midline of the humerus. And right now I have a measurement of 116 degrees. For active range of motion.
We're going to be assessing his end feel. So I'm going to stabilize right here again. Okay. Okay, good. Apply a little bit of overpressure. Very nice. Has a nice firm end feel. At this point, we're also going to be checking for passive range of motion. Okay, so just relax your arm. Okay, that's okay. Leave it there. Okay. So same positions. All right, so I got a measurement of 125. Sorry. Thank you.
So we're going to be doing wrist extension goniometry, where our fulcrum is going to be at the triquetrum. Our stationary arm is going to be parallel with the ulna. I'm going to have the patient actively extend his wrist. The moving hand is going to be parallel to the fifth metacarpal. So right now I got a measurement of 72 degrees. Okay. Now we're going to be assessing his end field. Okay. I'm just going to be applying a little bit of overpressure. He has a firm end field. And from right here, I'm also going to be measuring his passive wrist extension. Okay, so right there. Same alignments. All right. So I'm getting a little more, about 80. Okay, so we're going to be doing the first metatarsal phalangeal joint goniometry toe extension. So our fulcrum is going to be the midline of the first metatarsal phalangeal joint. Stationary arm is going to be parallel to the first metatarsal. Our moving arm is going to be parallel to midline of the first phalanx. So right now I'm going to have actively extend your toe. Okay, good job. Good. Very good. So right here, I see that the patient has a range of motion of 74 degrees. Now we're going to be assessing for his end field. So I'm going to be applying a little bit of overpressure, and note that has a firm end field. So at this point, we're also going to be taking the passive range of motion. So again, same alignment. Okay. So it seems that he has 75 degrees of range of motion. So now we're going to be doing a manual muscle test for shoulder horizontal abduction in the anti-gravity position. So I'm going to be palpating for the posterior deltoid as I instruct the patient to bring the arm out and extend it. So I feel for activation of the posterior deltoid. So I'm going to be applying my pressure distal hand, and I'm going to apply slight, moderate, strong. Oh, he didn't break. He gets a 5. Good job. So now we're going to be doing a manual muscle test for horizontal abduction in a gravity minimized position. So right now, I'm going to have the patient to try to bring his arm back as further as he can, and I'm going to be palpating the posterior deltoid. Okay, so go ahead. Very good. I see that he's going through the whole range of motion, so he will get a grade of 2. So now we're going to be doing a manual muscle test for the middle trapezius in the anti-gravity position. So I'm going to be stabilizing or palpating the middle trapezius as I have the patient actively bring back the arm and retract the scapula. As I feel for activation of the middle trapezius, I'm going to be applying a little bit of pressure, of slight, moderate, strong. Okay, so he broke in strong, so he will get a he broke from moderate to strong, so he'll get a 4+. So now we're going to be doing a manual muscle test for the lower trapezius. And what I'm going to be doing is I'm going to first palpate the muscle, the lower trap, and stabilize the arm as I have the patient actively elevate his shoulder about 120, 130. Okay, good. I start to feel the muscle activate right here. And as I am, I'm going to apply now the resistance down at the lower arm. Ready? Slight, moderate, strong. Okay, so he broke on moderate, he'll get a 4. So now we're going to be doing a manual muscle test for the lower trapezius in the gravity minimized position. So I'm going to be stabilizing or palpating at the lower trap, the inferior border of the scapula. And when I'm just going to be guiding the patient's hand as I tell him to try to move through the range of motion as I feel for the activation of the lower trapezius. And since he's able to go through the full range of motion in this position with a good activation, he'll get a 2. So now we're going to be doing a manual muscle test for the serratus anterior. We're going to have our patient's arm at about 120 degrees. You're going to stabilize the scapula with your thumb at the lateral border, index finger at the medial border. You're gonna press down. You ready? You're gonna hold it here, press down. Slight, moderate, strong. Okay, so he broke there, and so he will get a 4. Okay, he broke to moderate pressure, so you get a 4. So now we're gonna be doing a manual muscle test for elbow extension in the anti-gravity position. So I'm gonna be stabilizing and palpating the triceps for triceps activation. So I'm gonna have the patient actively contract into elbow extension. I'm gonna feel for his triceps contraction. I'm gonna be putting my force down into the distal arm for, ready? Slight, moderate, strong, good. He didn't break, so he'll get a 5. So now we're gonna be doing a manual muscle test for elbow extension in gravity minimized position. So right here, I'm just gonna have you extend your elbow, okay? Okay, so just extend your elbow, good job, and I'm just guiding with no help. So he goes through the full range of motion in this position, so he will get a 2. Okay, so now we're gonna do a manual muscle test for wrist flexion. So I'm gonna have the patient actively flex his wrist, and I'm gonna be palpating for his flexor carpi ulnaris and flexor carpi radialis. Now, at this position, I'm going to be applying pressure just to see how strong his muscles are. For slight, moderate, and strong pressure, he was able to hold strong pressure, so that means he gets a 5.